Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're going to be talking with Lori Bartenfeld of Hamilton Spine Health and Sport in Dalton. Lori is a manual therapist at Hamilton Spine Health and Sport inside Bradley Wellness Center, located at 1225 Broadrick Drive in Dalton, Georgia. Hamilton Spine Health and Sport is comprised of a multidisciplinary team of manual therapists, a certified performance trainer, and a golf instructor. Today we're going to be talking about neck pain. Now, Lori, I've heard people say that they have a crick in their neck, and of course I've experienced a crick in my neck. What is happening in our necks when we have a crick in our neck?
A crick in the neck is basically when you wake up and you can't turn your head. You may feel stiffness, pain, spasms, but ultimately there's an inability to turn your head.
So what causes neck pain?
Ultimately, it's an overstrain or stress of the joints. And what happens is our bodies are wired up to protect us. And if we get too much stress or strain on these joints, there can be a reaction of the muscles around the joints to spasm and tighten. And that's what limits our ability to turn and move our heads. And in the case of our necks, most of the turning happens in the very upper cervical portion of our necks. And when we're unable to do that, we have no choice but to compensate in the lower portions where it's really not designed to do that, and that adds strain and stress to all of the tissues, not only in your neck, but in your shoulders, upper back. We often see that as well.
Well, Lori, what causes this stress that you talk about, the stress in our necks? What causes that?
Some people, as in the crick of the neck, have this sensation that they may have just slept wrong or that their pillow is bad for them, but that's really not the case. There's nothing wrong with your pillow. It's just that there's a problem with their neck. And if oftentimes we can look and see that over maybe the days prior or weeks prior that there's been a undue stresses to their neck that kind of led up to this. Some of the specific situations can include things like people may be doing a lot of bending over, working in the yard, pulling weeds. Other examples may include playing with children or grandchildren, and they're bent over doing that for an extended period of time. Sitting at a desk for a prolonged period of time and not taking breaks. All of those things can kind of add up and put strain on our joints.
Is there anything that we can do to prevent neck pain?
Yes. In our therapy sessions, we spend a great deal of time working on identifying areas in which people demonstrate bad posture and improper mechanics and movement patterns. Those bad postures and mechanics can add stress to an already stressful day. One example that I'm thinking of right now that we see a lot in this high-tech world is poor posture while looking at our cell phones. Our heads weigh about 10 to 12 pounds, and if we're in a posture where our heads are actually flexed about 45 degrees, which is what we see when people look at their phones, then that adds that 10 to 12 pounds. It actually multiplies it by 5 to 6 times. So it's like 50 to 60 pounds on your neck as we're scrolling on our phones. So it's a lot of things like that. We look at just mundane things, sitting at your desk, in the car, golf cart, standing postures at the grocery line, even turning while we're checking our blind spot while driving. So each person can be different things they exhibit or mistakes, and we help them to try to eliminate those to prevent stress.
Well, I understand now, but if I'm having this pain, how long does it take to get relief?
Usually 3 to 4 sessions of rehab with us can get people feeling better. But on the first visit, we not only evaluate, but we do treat. We do the manual treatment. And most of the time, a person can tell a difference in their ability to move on that first day.
So how long are the manual therapy sessions at Hamilton Spine Health and Sport?
Typically about 30 to 45 minutes. Those are follow-up sessions. The first visit obviously takes longer with paperwork and the evaluation and just getting to know the person and their problems and issues. And then we're a little different than traditional therapy, which they may see you once or twice or even 3 times a week. We see you once every probably week or 2. And again, 3 or 4 sessions should see a noticeable difference.
Wow, Lori, that is great. Thank you so much for coming on the show today. We've learned so much, and we're glad that you were here.
Thank you so much. It's my pleasure.
For more information or an appointment at Hamilton Spine Health and Sport, call 706-529-3686 or visit hamiltonhealth.com/spine-and-sport. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.